Bill, back to the studio now. On Thursdays, we always talk with people from the medical community. Today, Jacqueline Carroll here is she's a physician assistant from New Hanover Regional Medical Center, talking today about the differences between an ER visit and a visit to one of the urgent cares. I know I've gone back and forth in my head at kidney stones. It was like, all right, do I go to the ER? Do I go here? I opted for ER. When is the decision right to just, go up the street, go to the urgent care? I know it's better hours. It's
yes.
Convenient.
Yep. The best thing to do when you think about if you need to be in the emergency room or if you need to be at the urgent care is do you have a true medical emergency? Is there a problem that needs to be treated absolutely immediately that could potentially be a life-threatening emergency? Or do you have a sinus infection or an earache or a minor sprain? That would be an urgent care matter. We can see you probably quicker. We can take care of you just as well as you would be seen at the emergency room, and it's probably less expensive for you.
Yeah, it's interesting, you hear urgent care, which you would think, hey, I've got something urgent, I need to go. But then with the emergency, it's almost, you said, like immediate. You need something done right away.
Yes, and they triage you at the emergency room. The nurses that are staffed there, if you have a minor problem, you will be put back in line for the urgent problems, for the heart attacks or strokes or badly broken bones. So it's better to come to our urgent care. It will be much more quick for you. And we have physician assistants, nurse practitioners, and doctors that are all staffed there.
So you're
highly
getting
trained.
very good quality care.
Absolutely. You're getting the same care that you would be getting at the emergency room.
So again, I don't want to stress the convenience part, but I know where I live, it's literally a half a mile away.
Me
and for
too.
me, you roll in, I've got the cold, I've got this. And then when you go to the ER, you'll see people that are there, they've got the cough. How is it that you just stress to them, look, this is a much better option for you?
Well, I think a lot of the patients that we see are sent to us by their providers. They're sent to us either by their pediatrician. If they're full and they can't be seen and their child has an ear infection, they send them to us. The nice thing about that, too, is that our medical records are the same, so I can see what that patient had for their ear infection or their urinary tract infection the last time they were treated by their doctor, and do that same thing if it worked for them. Yeah,
and one thing I've learned, I moved here in 2000. When I first moved here, it was, got to go to Chapel Hill, got to go. We have some of the best medical facilities in the state of North Carolina right here in New Hanover County. I appreciate the time.
Thank you.
Thank you very much. We're back after this.